Sustainable Healthcare: Digital Solutions for Climate Challenges by Pardeen Kasi. Climate change is no longer just a hypothetical issue. It is a crisis that impacts every facet of our lives. Rising temperatures, extreme weather events, and shifting disease patterns are directly and indirectly straining global healthcare systems. The irony: healthcare itself is a significant contributor to climate change, responsible for approximately 4.4% of global greenhouse gas emissions, a figure equivalent to the emissions of some developed countries. From energy-intensive hospital operations to wasteful supply chains, the sector has a dual challenge: adapt to the effects of climate change while reducing its environmental impact. But here's the good news. Through digital transformation and advanced technologies like AI, IoT, and automation, healthcare can become a leader in climate action. Let's explore how. Energy-efficient digital operations. Hospitals are among the most energy-intensive buildings, consuming 2.5 times more energy per square foot than average commercial buildings. Digital transformation can mitigate this through energy management systems that monitor and optimize electricity usage. For example, transitioning to cloud-based platforms not only eliminates physical servers, but also reduces energy use by 65% in IT operations. Moreover, electronic health records (EHRs) cut down paper waste, reducing the industry's reliance on deforestation-heavy practices. Telemedicine reduces carbon footprints. Patient transportation to and from healthcare facilities contributes significantly to emissions. Telemedicine addresses this by enabling virtual consultations, which eliminate the need for physical travel. A study from the UK found that telemedicine programs reduce carbon emissions by 1.7 million kilograms in a single year, thanks to fewer patient journeys. Imagine scaling that globally. Transformative, isn't it? AI for waste and energy reduction. Medical imaging, lab testing, and surgical procedures are resource-intensive processes. AI-powered tools can analyze hospital workflows to identify inefficiencies, ensuring resources are only used when necessary. For example, implementing AI-driven scheduling for MRI machines has been shown to reduce the idle machine time by 30%, saving electricity and operational costs. Smart hospital infrastructure using IoT. IoT-enabled devices create a smarter hospital environments. Connected sensors monitor and adjust energy used for lighting, heating, and air conditioning in real time, ensuring efficiency. Research suggests IoT-enabled HVAC systems can reduce a hospital's energy bill by 20 to 30% annually. Beyond financial savings, this translates into substantial emission reductions. Sustainable supply chain through blockchain. Procurement in healthcare often involves long supply chains and significant waste. Blockchain technology brings transparency, allowing healthcare organizations to track the life cycle of supplies, from sourcing to disposal. This reduces unnecessary waste and enables environmentally responsible purchasing. For example, using blockchain in pharmaceutical logistics cuts supply chain emissions by 35% in recent pilot projects. Renewable energy in healthcare facilities. Healthcare facilities are increasingly adopting renewable energy sources like solar and wind. Digital platforms optimize these renewable systems by predicting energy demand patterns and integrating them seamlessly with the grid. A healthcare network in Australia achieved 70% reduction in operational emissions by shifting to renewable energy supported by digital monitoring systems. Predictive analytics for disaster preparedness. Climate change is increasing the frequency of extreme weather events like hurricanes and floods, which disrupt healthcare services. Predictive analytics powered by AI allows hospitals to anticipate these events and prepare emergency response plans. For instance, AI models accurately predicted heat wave-related hospital admissions during the 2021 Pacific Northwest heat dome, enabling resource optimization that reduced emergency room overcrowding by 15%. Circular economy and medical equipment. Circular economy principles supported by digital tools promote the reuse and recycling of medical devices. Hospitals using these systems have reduced waste by up to 50% while lowering procurement costs. By tracking equipment lifecycle data, digital tools ensure devices are recycled responsibly, keeping them out of landfills. Data-driven carbon footprint tracking. Healthcare organizations often lack visibility into their carbon emissions. Advanced data analytics platforms provide real-time dashboards that measure emissions across departments. This enables targeted interventions. For example, a hospital in Germany reduced emissions by 25% in 5 years simply by monitoring and addressing inefficiencies flagged by analytics. AI and automation for remote monitoring. Wearable devices and remote monitoring technologies reduce the need for frequent in-person visits. These technologies are powered by AI and IoT, saving resources. A study in the US showed that integrating remote patient monitoring systems into care for chronic diseases reduced in-hospital days by 20%, contributing to significant energy and cost savings. Challenges in implementation. Of course, implementing these technologies isn't without its hurdles. Initial investments in digital infrastructure can be high, and integrating advanced technologies require robust training and change management. Additionally, issues like data security, interoperability, and resistance to change among staff often slow adoption. Overcoming these challenges requires partnerships, clear policies, and an industry-wide commitment to sustainability. Future outlook. Looking ahead, the convergence of green energy, digital health technologies, and policy incentives could make healthcare one of the most sustainable sectors globally. The healthcare industry could set the gold standards for climate-friendly operations by embracing innovations such as carbon-neutral AI, green IoT devices, and smart grids. By 2030, experts predict that digital transformation could help reduce healthcare's global emission by up to 50%. Creating a system that not only heals people but also the planet. Climate change is a defining challenge of our time, and healthcare stands at a unique crossroads. By leveraging digital transformation, AI, and other advanced technologies, the industry can lead the fight for a sustainable future. Let's commit to reimagining healthcare not just for better patient outcomes, but for the health of our planet as well. Together, we can make a difference. The future of healthcare is sustainable, digital, and green. Let's innovate for a healthier world, because the health of the planet and its people are inseparable. Thank you.